You've probably heard a ton about physician burnout, but today we're going way beyond the usual headlines. We're going to pull back the curtain and listen in on what doctors are actually saying about their jobs, in their own words, when they think no one else is around. So, what happens when doctors get to talk, just to other doctors? It sounds like a simple question, right? But the answer is incredibly revealing. When they're away from the public, away from hospital admin, and just speaking with their peers, well, the whole conversation changes. And we got a chance to listen in. How? We looked inside GMed. It's the world's largest private peer-to-peer network exclusively for physicians. So what you're about to hear isn't from some formal survey. Nope. This is the real stuff, the candid, unfiltered discussions happening between colleagues that show us how doctors truly feel about their jobs right now. All right, let's dive right into the big one, burnout. But here's the thing we noticed immediately. The way physicians are talking about it, it's completely changed. It's not seen as some temporary crisis anymore. It's something much, much deeper. This quote from a family doctor in Canada just nails it. I wouldn't say I'm burned out. I'd say this is just the baseline now. Think about that. The constant stress, the exhaustion. That's become the new normal. What used to be a breaking point is now just Tuesday. It's the day-to-day reality of the job.
So what's driving this new baseline? Well, the data from GMed polls gives us a really clear picture. Look at this. Tied for the top spot, at a whopping 27% each, are administrative burden and staffing shortages. Right behind that, frustrating digital systems. So you see, this isn't about individual resilience. These are huge systemic problems.
And in response, doctors aren't really recovering, they're adapting. They're doing what one physician called a protective recalibration. It's basically a survival strategy, a conscious choice to pull back a little, to conserve their energy, just to make it through in a system that demands so much. And this leads us to this massive contradiction that sits right at the heart of modern medicine. It's this constant battle between finding the work meaningful and wondering if you can possibly keep doing it. This doctor from the Netherlands put it perfectly. The passion for medicine, for helping patients, that's still there. That purpose is what gets them up in the morning. But there's this growing feeling, this fear, that the way the job is structured, it's just not built to last. And this slide just lays it all out, plain and simple. On the left, you've got what doctors spent a decade or more training to do: complex problem solving, diagnosis, patient care. And on the right, the reality of the job today: endless paperwork, data entry, and bureaucracy. It's this huge gap between the promise and the reality that's a major source of frustration. And let's be super clear about something, because this next quote from a doctor in Finland really hits the nail on the head. They don't regret becoming a doctor. They regret the system they have to work in, especially in primary care, where all these pressures just feel relentless. It's not the calling, it's the cage. Okay, so now let's talk about something that the typical burnout surveys totally miss. It's this invisible, cumulative weight that doctors carry around with them, a load that doesn't just disappear when they clock out. As this oncologist from France shared, there's this private burden to the work. Every bad outcome, every difficult conversation, you carry that. It all adds up. And that sense of responsibility, it's just relentless. A critical care doctor in Canada said it feels like it never really ends. It just pauses between shifts. And that's what's so draining. Even on a quote-unquote lighter day, the mind is always on, always processing, always carrying that emotional weight. And listen, this isn't just a vague feeling. It has real, measurable consequences. When GMed polled physicians about their experience after a patient's suicide, almost 62% of those who'd been through it said they feel significant distress always or often. That just shows you how deep the emotional toll of this job can be. So when you put all of this together, this new baseline of burnout, the struggle with sustainability, that heavy emotional load, you start to see a bigger picture. You start to see a healthcare system that is, itself, just running on empty. And let's make this really concrete. Just look at this number. By 2034, the United States alone is projected to be short by as many as 124,000 physicians. This isn't some far-off problem. The cracks are already showing. And this quote from a US doctor sounds awfully familiar, doesn't it? It's the same idea we heard about burnout. Being short-staffed is no longer a temporary crisis to be fixed. For many, it's just the normal way of doing business now. It's just how things are. And that has this huge ripple effect across the whole system. Of course, it means a bigger workload. It leads to what's called role compression. That's when doctors are stuck doing clerical work. It causes moral distress when they're forced to make impossible choices about care. And it means everyone's just slapping on band-aids instead of actually redesigning the broken system. And all of this leaves us with one final, massive question. The conversations on GMed show us a profession that's incredibly resilient, full of people who are adapting to unbelievable pressure. But they also show a system that's teetering on the edge. So yeah, our doctors are adapting. The real question is, can the system they work in afford not to?